So we are discussing the arm over here. Okay, what is this muscle?
Deltoid.
Deltoid. Okay, and that what is this muscle?
Triceps.
Triceps. Okay, then what is this head?
Long.
Medial head.
Long head of triceps, and then
Long head. Short head of triceps.
lateral head of triceps. Okay.
And deep is the medial head.
Okay, if we remove these two heads or reflect the two heads, here is the medial head. Okay, this is the medial head which is arising from the posterior surface of the lower half of the shaft of the humerus. Isn't it or not? So this is the medial head which I have cut over here. Okay, so here will be the medial head. Okay, this is a long head, this is the lateral head. Both will join together and form this tendon. Okay, and deep to the tendon and this muscle will be the medial head of the triceps, okay, which arises from the posterior surface of the shaft of the humerus, but from the lower half. Okay, and it will insert into this tendon and also into the superior surface of the olecranon process. Okay, superior surface of the olecranon process. Okay. So if we reflect all these heads, that means the lateral and long heads, you can see the radial groove over here. Okay, can you see the radial groove?
Yes.
Because this is the bone. Can you see? This is the bone. Okay, this is the bone, and here just below the lateral head will be the radial groove. Isn't it or not? Lateral head will be arising just above the radial groove, isn't it? This is the lateral head which is arising just above the radial groove, and here whatever the contents over here are the contents of the radial groove over here. You can see the obliquity of the nerve and vessels over here. They are not going vertically like this. They are going from medial to lateral direction. Okay, and what is this nerve? Radial nerve.
Radial nerve.
Can you see? Can you see the branch from the radial nerve which is going towards the long head? So which is present in the axilla, isn't it or not? This base is nothing but the axilla, isn't it or not? Right? From the axilla, a branch is going from the radial nerve towards the long head. Okay? In the same manner, the other branches also will go. Okay? You can't see all the other branches, but in that manner, the rest of the branches will go. Okay? So what is this nerve? Radial nerve. What are these vessels? Profunda brachia vessels. You can see one more branch over here going towards the medial head. Isn't it or not? The white structures are the radial nerve branches. Okay? Which is going towards the medial head. Okay? Just a moment here. These are other forceps, yeah? Okay? Can you see that? This is a radial groove over here, just below the lateral head. Okay? And this is a radial nerve within the radial groove. Okay? And these are the different branches. Can you see? They are the different branches of the radial nerve. Okay? This is one branch, this is another branch. Okay? This is the main trunk of the radial nerve, which is going over here and lying in between the brachioradialis and which muscle? And no, teres major. No, see here. This is the posterior compartment. This is the anterior compartment over here, isn't it? So the radial nerve will go over here. Okay, goes over here through the radial groove and enters into the anterior compartment in between which muscles? Brachioradialis and brachialis. Absolutely. So for example, we know that this is a brachioradialis. Okay. So just deep to the brachioradialis will be the trunk of the nerve. Above the brachioradialis, which muscle is present? Brachialis is present. Isn't it or not? So the same nerve, if you see over here, you can see the movement of the nerve. Isn't it or not? So the nerve which is in the axilla, which is in the radial groove, is present in between the brachioradialis and brachialis over here. So you can understand the course of the nerve from the posterior aspect, piercing the lateral intermuscular septum and enters into the anterior compartment in between the brachioradialis and brachialis. Okay. Okay. This is about the posterior compartment of the arm. And of course, one more nerve. What you are going to see over here is which nerve? Ulnar nerve. You can see. So this is the posterior aspect. This is the lateral epicondyle. This is the medial epicondyle. So So the nerve which lies over the medial epicondyle is nothing but
Ulnar
ulnar
nerve.
nerve, obviously. So this is the ulnar nerve which pierces the medial intermuscular septum and enters into the posterior compartment and again enters into the anterior compartment of it. Isn't it or not? Right? Yeah. So this is the ulnar nerve. So what are the structures you are supposed to identify in the posterior compartment of the arm? The long head of the triceps, lateral head
Lateral head
of the triceps, of course the medial head of the
Middle head of the
triceps,
tricep.
and if you reflect it, this is a radial groove or
Radial
spiral
groove,
groove
spiral
which
groove.
contains the trunk of the radial nerve along with the branches of the radial nerve, what we have discussed, and also the arteria profunda brachia vessels. Okay, and the whole bulk of the tendon, that means the whole bulk of the muscle will be inserted into the superior surface of the olecranon process. Okay, and then one more structure what we are going to find over here is the ulnar nerve and branches of the profunda brachia vessels. We have discussed already, right? So this is about the posterior compartment of the arm. Okay, we'll see we have the rough idea about the posterior compartment of the forearm. Okay, we have seen already the lateral group of muscles, isn't it? First of all, superficial group, and then the deep group of muscles. Okay, so we'll see apart from the supinator, we'll see rest of the muscles over here today. Okay, tomorrow we'll see the supinator. Okay. So the first muscle, superficial muscle, nothing but the anconeus. Anconeus. Okay, arises from lateral epicondyle and inserts into the. Can you see the olecranon process over here? Right. This is inserting over here. Okay, and this is the olecranon process. This is the posterior surface. Can you see? And this is the posterior border. Isn't it or not? From the ulna, this is the posterior border to which the deep fascia and also which structure will insert, which structure will attach? Deep fascia and towards the upper aspect. Which structure, which fibrous structure will attach over here? So the deep fascia, with the deep fascia, one flattened tendon will merge and will be attached to this posterior border. What is that? Which aponeurosis? Bicipital aponeurosis. Okay. So to the posterior border of the ulna, the deep fascia along with the bicipital aponeurosis will attach. Okay, so that flexion will be possible because of the bicipital aponeurosis. Okay? Yeah. So can you see the fan-shaped muscle over here? This is the anconeus. Can you see? Right? This is the anconeus muscle. Can you see? From this is the medial epicondyle because this is the ulnar nerve. This is the medial epicondyle towards the medial aspect. This is the lateral epicondyle towards the lateral aspect. So from the lateral epicondyle, from the posterior surface, the anconeus muscle will arise over here and insert into the lateral surface of the olecranon process and upper part of the posterior surface of the ulna. Isn't it or not? Can you see? Can you coincide? This is the elbow joint. This is the olecranon process. This is the superior surface. This is the posterior surface. This is the lateral surface. This is the medial surface. Isn't it? Towards the lateral surface and the upper part of the ulna, posterior surface of the ulna, this anconeus will insert. So what is the action of the anconeus? Obviously the extension of the elbow joint. Extension of the elbow joint. Okay. And then followed by what are the other muscles? Three lateral group of muscles I have shown you already. Brachioradialis.
Brachioradialis.
Can you see? The brachioradialis. Sorry. The brachioradialis, extensor carpi longus, and extensor carpi brevis. Three lateral group of muscles. Can you see the lateral group of muscles over here? Right? Again. The brachioradialis, the superficial most one. The extensor carpi longus and extensor carpi brevis. Can you see?
Yes.
So these will occupy the lateral surface, lower half of the lateral surface of the radius, and will go through a groove over here. Isn't it or not? This is the dorsal tubercle of Lister. Okay. Towards the lateral aspect, a groove will be there, which carries this extensor carpi longus and brevis tendons. Isn't it or not? Extensor carpi longus brevis comes over here and go over here and will insert over here. So that's why a groove next to the or lateral to the dorsal tubercle of Lister will lodge these two tendons. Can you understand or not? Right? Right. So that is about the extensor carpi longus and brevis and brachioradialis, lateral group of muscles among the superficial group. Okay. What are the other four muscles? What are the 4 muscles? Extensor, digitorum. So obviously, so these are the lateral group of muscles. If you see here, 2 superficial group of muscles are there. Okay. Among these, what is this muscle? See here. Can you see the digitorum tendons? Can you see? These are the 4 digitorum tendons. Can you see the movement of the digitates towards this one, this one, this one, and this one? Can you see? Right? Right. So the next muscle will be extensor digiti minimi. Can you see the minimi tendon over here? Right? Going towards the little finger. Extensor digiti minimi. Yeah. Okay. Extensor digiti minimi. Probably this is some other fascia, but this is the tendon. Okay. It will not divide like this. Okay. We'll see that. Okay.
This is not tendon.
I have to dissect. Yeah. I have to dissect and see. Okay. I will dissect and will tell you tomorrow. Okay. First of all, we will consider only this tendon as a digiti minimi. Okay. This is a digiti minimi tendon. Then followed by extensor carpi ulnaris. Can you see extensor carpi ulnaris? It is extending over here till here. It is not moving any digits, right? It will be over here. Can you understand? So once again we will see the superficial group, the anconeus over here, okay? Then followed by the lateral group of muscles. First of all, the superficial most one is the brachioradialis. Then followed by extensor carpi radialis longus. Extensor carpi radialis longus and extensor carpi radialis brevis. These are the lateral group. If you see, these are the lateral group of muscles, and 4 posterior group of muscles among the superficial group. Okay. What are the 4? First of all, the digitorum, and then followed by extensor digiti minimi, and then followed by extensor carpi ulnaris. Okay. So totally 1, 2, 3, 4, and 3 lateral group of muscles. So totally 7 superficial group of muscles. Okay, 3 lateral, 4 posterior. Okay, among the superficial. Now we will find the deep group of muscles. Okay, follow this order. If you don't follow this order, you will confuse with the deep muscles. Okay, so whatever the muscles arise from the radius, you have to focus on the radius. Whatever the muscles arise from the ulna, you have to follow the ulna. Okay, then only you can get the deep muscles. Okay. First of all, we will find the radial muscles. Okay, so if you separate this superficial group of muscles, okay, you can see the radius. Okay, you can see 2 muscles are arising over here, isn't it or not? So, okay. For understanding sake, I am cutting these superficial veins. Okay, these are the superficial veins. Can you see the superficial veins? Okay, I am cutting these for better understanding sake. See here. Can you see this is the bone? Can anybody see that is the bone? Next time onwards, not next time onwards, it's okay, fine. Whoever is having, this is a bone. Okay, these are the lateral group, these are the superficial group of muscles. But if you see properly, this is the bone from which, okay, this entire thing is the bone, radius, isn't it? Towards the thumb is the radius. From the upper part, one muscle is arising, and from the lower part, another muscle is arising. Can you see? 2 tendons over here, right? 2 tendons. So what might be this muscle? Abductor pollicis longus. This is the abductor pollicis longus from the upper part of the radius on the posterior surface. From the lower part of the radius on the posterior surface, extensor pollicis brevis. Okay. If you see properly, the abductor pollicis longus and extensor pollicis brevis will be crossing over all these 3 muscles, lateral group of muscles. Can you understand? This is the abductor pollicis longus. This is the extensor pollicis brevis arising from the posterior surface of the radius. But these, because they are supposed to insert into the thumb, they are crossing all these lateral group of muscles superficially. Can you see the superficial? For example, if this is a brachioradialis, extensor carpi radialis longus and brevis. Okay, these are the tendons. If you see properly, these tendons, abductor pollicis longus and extensor pollicis brevis, are crossing over these tendons. Can you understand? Can you understand? Right? So these deep group of muscles now became superficial, and these superficial group became deeper over here. Can you understand now?
Yes.
Right? So these are overlapping the three lateral group of muscles, superficial group of muscles, and will insert into the thumb. Getting it or not? Yes. So these are, one is abductor pollicis longus and extensor pollicis brevis. Now we will see the ulnar muscles. Okay. From above downwards, so what is this muscle might be? What is this muscle might be? Which pollicis? Extensor pollicis longus. We know that abductor pollicis longus arises from both radius and ulna. Just next to the abductor pollicis longus over the ulna will be the extensor pollicis longus. Can you see the movement of the thumb over here? Extensor pollicis longus. No other digit is moving, only the thumb is moving over here. Extensor pollicis longus. Then next to that extensor pollicis longus will be extensor indicis. Okay. So one more muscle arising from the lower part of the posterior surface of the ulna. Can you see the movement of the tendon towards the index finger? So indicis, extensor indicis. Can you understand everybody now? Right? So once again the deep group of muscles. Okay. Just separate the superficial group of muscles from the lateral, posterior group of muscles from the lateral group, and you can find the muscles arising from the radius and ulna. Okay. From the radius, this is the radius. First of all, you have to identify, because over this lateral surface, these two tendons will lie. Isn't it or not? So next to that will be the posterior surface of the radius. From the upper part of the posterior surface of the radius, a muscle arises nothing but the
Abductor pollicis longus.
abductor pollicis longus. Abductor pollicis longus. Can you see the abduction movement? Right? Abductor pollicis longus, and then followed by next one will be the extensor pollicis brevis. Brevis means the shorter muscle from here till here. Okay. Again the movement of the thumb over here. Right? Extensor pollicis brevis. But these two tendons will overlap which group of muscles? Lateral group of muscles, nothing but the brachioradialis, extensor carpiodalis longus and brevis. Okay, so these tendons will overlap over these superficial group and insert into the thumb. Okay, so these two muscles are from the radius. And now we'll see from the ulna. What are three muscles? What we are seeing from ulna? From above downwards, first of all the abductor pollicis longus, common origin for both radius and ulna. Leave about that. That is a superficial group of muscle. Then followed by the deep group of muscle. First muscle, next to that will be the. See here, this is the ulna again. Can you feel? Huh? This is the bone. No. Put your finger and feel. Can you feel the hard structure? That is the bone. Okay. Again, here you can feel the hard structure. Here, that is the bone, radius, right? Okay. If anybody is having gloves, you can see. Okay, fine. Okay, this is the ulna. Can you see? This is the ulna. Isn't it or not? This is the ulna. Obviously, this is the ulna. From the posterior surface, here will be the posterior surface, right? Posterior border, this is the posterior border, and deeper will be the intraosseous border. In between the posterior border and intraosseous border is the posterior surface. So, roughly, this is the posterior surface, isn't it? So, from that, from below the abductor pollicis longus, one muscle will arise over here. Can you see the origin? Can you see the origin over here? From above, next to the abductor pollicis longus. This tendon, and one more muscle, this tendon. Can you see? One is from above, one is from below. Can you see the above and below muscles? So one is going towards the index finger. Sorry. So one is going towards the thumb, nothing but the extensor pollicis longus, and next muscle will be the extensor indicis. Can you see the extensor indicis moving over here towards the index finger? Okay. So what you have to understand over here is extensor indicis tendon and extensor digiti minimi will be merging with whenever, because the extensor digitorum will be giving rise to 4 tendons. Okay. But the extensor indicis, for example, this is the extensor indicis. Can you see that? Extensor indicis. Okay.
Sir, only this tendon is
I have to
extensor
separate.
indices.
Yeah, obviously. See here, this is. You have to dissect still. Dissect two lines. See here, this is the digitorum tendon. Okay, this is the digitorum tendon. That's why it is becoming stretched. Okay, this is the digitorum tendon, but this is extensor indicis. Can you see the movement of the extensor indicis over here?
Yes, sir.
Right? Extensor indicis towards the medial side. Towards the medial side, the extensor indicis goes along with the one of the distal tendon and merges with the what is that? Dorsal distal
Dorsal
expansion.
distal.
Okay, this tendon will what is that? Join with the dorsal distal expansion. In the same manner, one more dorsal distal expansion. Nothing but the, for example, if this is a tendon, this is a tendon, isn't it? Digitorum tendon, right? You can see the digitorum tendon moving over here, and along with that will be the distici minimi tendon will be there. Okay, distici minimi.
नहीं दिख रहा है.
This one, can you see that? Extensor digiti minimi. This is separate tendon, and these are the four tendons. Can you see the movement of the tendons? See here, it is moving over here. It is moving again. It is moving again, and it is moving again, isn't it? So four tendons to the four digits. But here, this is the tendon of digiti minimi. Can you see that? Digiti minimi tendon is moving over here. So this digiti minimi tendon joins again at the medial surface of this digitorum tendon and again merges with this dorsal distal expansion. Can you understand? So the index finger is supported by two tendons, one from the digitorum and one from the extensor indicis, and one more finger like little finger will be supported by extensor digitorum tendon and extensor digiti minimi tendon. And again the thumb will be supported by two tendons. What are those? Extensor pollicis longus and extensor pollicis brevis. Can you understand now? Two tendons for the thumb, extensor pollicis longus and brevis. And two tendons for the index finger. One is the digitorum tendon, one is the extensor indicis. And for the little finger, again the extensor digitorum and extensor digiti minimi. Can you understand everybody? Right? Yeah. So if you see properly, this is the extensor retinaculum. This is the extensor retinaculum. Extends in between the anterior border of the radius just above the styloid process, and also the pisiform and triquetral. Pisiform and triquetral bones. Okay, this is the extension. From the anterior border of the radius just above the styloid process, it will go over here and attaches to the carpal bones, nothing but the pisiform and triquetral bones over here. Okay, it will go like this. Okay, and dividing into multiple compartments, 6 compartments. Okay, we'll see that compartments tomorrow. Okay, so for today, these are the muscles what you're supposed to identify in the examination. Tomorrow we will see the interosseous nerve and interosseous artery and rest of the things. Okay, come on, carry on. The next batch.
This is extensor indices.